This is Marsha. I'm gonna let her introduce herself. I'm so excited for this workshop to be the person that gets to learn. So I'm gonna hand it on over. All you.
All right, hi everybody. My name is Marsha Wykes. I'm a physical therapist here in Lebanon, New Hampshire. I'm also a boot camp member at the West Lebanon location and have been having an awesome time learning and working out with all of the people there and all of you on Zoom. One of the things that kind of came to mind when they asked me if I wanted to do a presentation was how to incorporate some of my physical therapy knowledge in a way that would overlap with some things that I hear people talking about at boot camp, participants talking about achy knees or hip problems or back problems, and how that correlates to some of the exercises we do in boot camp, but also breaking it down further into just some movement patterns that might happen during your typical day, as well as some imbalances in flexibility and strength around your hip. In my 25 or so years of physical therapy practice, I have come to realize that the hip drives a lot of complaints about back and knee pain, especially knee pain. I would say the majority of patients I come in who complain of knee pain in the absence of a specific injury, they just kind of started having knee pain. I usually end up being able to trace it back to some of the hip things we're going to talk about. So today we're going to uncover some common movement patterns and something called neuromuscular control, how well your body controls its movements, and how that ties into flexibility and strength issues in and around the hip area. So first, I wanted to talk about the fact that a lot of people have kind of poor control of their hip muscles or decreased control of their hip muscles. There's even research and articles out there that talk about something called glute amnesia. So people have the difficulty or inability to turn on, recruit, contract, use their butt muscles, their glute muscles. And our glutes should really be one of the strongest, most powerful muscles in our lower body. And oftentimes we don't use them efficiently, and it creates some of these problems that we're going to talk about. So one thing I like to educate my patients on in regards to muscle dysfunction is the fact that muscles really exist in one of four phases or four stages. The first one I call unconsciously incompetent. You don't even know that your muscle isn't doing what it's supposed to do. The second phase is consciously incompetent, where someone so cruel as me points out to you what your muscle's not good at doing. The third one is consciously competent. Your muscle can do what you need it to do if you're consciously thinking about it. So that would be the stage where a lot of people would be in when they're working on learning a new exercise or learning a new movement pattern, and they're seeing themselves improve at doing it. But where we really need to exist is in an area called unconsciously competent. It means the muscle can do what it's supposed to do without you thinking about it. Because if you're out hiking or playing in a soccer game or whatever it might be that you're doing, you need the muscle to be performing correctly without you putting brain power into thinking about what it's doing. So we're going to talk through uncovering where your muscles are at on this timeline and figuring out what you can do to address them, which is what we'll mostly be talking about in the second session next week. Okay? So first off, let's talk through how the muscles on the outside, the side and back of your hip control some of your movement patterns. So the muscles on the side of your hip, their job is to control the position of your pelvis when you're standing on one leg. And then patients will also often say to me, I don't stand on one leg. Well, you do. Every time you take a step, you're standing on one leg. Every time you go down the stairs, you're standing on one leg. So the amount of times you stand on one leg in a day is really a lot. And if these muscles aren't controlling the position of your hip and pelvis correctly, I'm going to demonstrate what some of the problems are. So from a back view, When the muscles on the side of your hip are not controlling your pelvis correctly, when you stand on one leg, it allows your pelvis to dip to the side. Now I'm exaggerating this quite a bit, but when the muscles dip to the side, you lose your center of gravity and it can start to make your brain and body feel like it's gonna fall. So what your body will naturally do to counteract that is after the pelvis dips, it'll take your knee and aim it kind of inward like this. Okay, that's to improve your balance and your center of gravity and prevent you from falling. All right, if the muscles out here are working well enough, they can keep your knee aligned correctly and your pelvis aligned correctly and prevent those errant movement patterns. So I'm going to talk about some things that you can test on yourself, either by looking in a mirror or videoing yourself or having someone video you so you can see how you move during these different scenarios. Because the way you move in these scenarios is going to give us some information about which muscles are or are not working from a strength or neuromuscular control standpoint. So the first one is just thinking about a typical movement of getting up and down from a chair. And of course, I forgot to bring a chair over here, so give me a second. I'm just going to use this bench here. So if I'm sitting on this bench and I just go to stand up like I normally would be getting up from a chair, in an optimal scenario, my knees would stay lined up the same distance apart as my toes and my hips. So everything would be kind of parallel to each other. So it would look like this, okay? My knees stay pointed straight ahead in the same direction as my toes. But if my hips aren't working right, which we'll find in a lot of patients, and you might find it in yourself, you'll see this little movement where the knees dive inward. So it looks kind of like that, okay? So people use some momentum to get up sometimes, and you'll see their knees kind of push together. They might not come all the way together like I'm showing you, but you're looking for any kind of inward movement of your knees, and that's going to tell us that there is some weakness in those muscles on the outside of your hip, or that your brain just doesn't know how to use those muscles for that activity, and you need to spend some time teaching your brain how to turn those muscles on, okay? So we can translate that into some things we do at boot camp as well. So thinking about a squatting movement, it's really the same thing as getting up and down from a chair, okay? Your knees should point in the same direction as your toes are facing so that your toes, your knees, and your hips are all parallel to each other, okay? If you have weakness in, let's say, one hip, what you might notice when you come down into your squat is that one knee wants to angle inward a little bit. Or if it's in both hips, both knees want to angle inward a little bit. And our awesome coaches at boot camp talk a lot about using those muscles on the outside of your hip, thinking about pushing your knees apart, but we're going to uncover some other things you can do to be working on it in session 2 next week, okay? So when we look from a side view at a squat, we want to be thinking, we already talked about how the knees need to be going forward in the direction of the toes, but looking from a side view, what should happen when you're squatting is you should be thinking like you're trying to fold at your hips and push your butt back behind you. So a lot of people, when they squat, they think, bend my knees. And when you think bend your knees, this is what happens. Your knees go pretty far forward of where your foot is, okay? When you think fold my hips and sit backwards, my butt goes backwards, but my knees don't traject as far forward, okay? So folding at the hips and sitting the butt backwards like you're coming down to a chair decreases the load or the stress to the front of your knees, okay? So that's one thing that can help you decrease knee pain with squatting, okay? The other thing it does is by folding at the hips and pressing your butt backwards, it triggers your brain into using the powerhouse, the glute muscles more. So from a side view, the squat should look like that, okay? And from a front view, the squat should look like this. And we're going to talk about some different little tools you can use to teach yourself to squat that way, because at first it's going to feel pretty unnatural. okay? When we're doing a lunging motion, your coaches always talk about getting that back leg back far enough. And the reason for that is if you don't bring the back leg back far enough and you come into a lunge, you're doing that knee moving forward motion that we just talked about with the squat, which is really what we want, okay? But if you move your foot, your back foot, back far enough, you can see that my front knee doesn't traject too far forward, and I'm able to make sure that I'm using my glute muscles and not loading the front of my knee, okay? So when you're doing a lunge, you want to think about a wide spread from forward backward direction and dropping your back knee toward the floor, okay? Because if I think about dropping my back knee toward the floor instead of pushing my front knee forward, it really changes the exercise and how you're going to benefit from doing it, okay? Next, we're going to look at what it will look like stepping down from a step, okay? So when you're going down the stairs, what I oftentimes find in my patients when I watch them go down the stairs is that same kind of hip drop and knee diving inward that we talked about a few minutes ago. So going down the stairs with a poor neuromuscular control pattern would look something like this, okay? So my knee points inward compared to where my foot is, okay? Or we see a lot of dropping of the hip and the butt pokes outward while the knee pokes inward, okay? So in a proper going down the stairs pattern, your pelvis is going to stay level and your knee is going to be pointed straight ahead as much as possible. Now in women, we may see that it goes in a little bit because we have wider hips, and that's just the way it works with the bony alignment. But you want to see the least amount of inward movement as possible when you go down the stairs. And this, of course, translates to going down a hill or hiking when you're hiking back down, okay? So if your brain is thinking about hiking and not tripping on rocks or roots, it can't really be thinking about controlling the trajectory of your knee, okay? And if this kind of inward torque is happening a couple thousand times a day with different steps and movements that you take, you can imagine the stress to the knee, but also to the hip, okay? The next thing I want to show you is if I just stand here and all I do is tighten the muscles on the outside of my butt and hips, what you're going to see if you really zoom in at what my knees are doing is you're going to see my kneecaps turn outward a little bit, okay? So watch where my kneecaps are right now. And now I'm going to squeeze my glute muscles, and you see that they rotate outward a little bit, okay? So when they rotate outward, what that's telling you is that using these muscles prevents this motion from happening because it encourages a little bit of this motion, okay? So next, we're going to look at a couple things related to flexibility and how that can play a role in kind of the health of how well your hips are working for you, okay? So one of the key important flexibility pieces in and around hip health is hamstring flexibility. I know that the coaches talk about making sure that your hamstrings are rolled out and stretched out and things like that. But I'm going to talk you through a couple ways to kind of assess for yourself how much tightness or shortness you might have in your hamstring muscles. So if you lie on your back and you use something like a yoga strap or a yoga belt, I have a dog leash here because that's what I have available at home, okay? Or you could have a partner, a family member lift your foot for you, but the belt works okay. You're gonna lay flat on your back. You're gonna keep your leg that you're testing as relaxed as you can and make the belt do all the work. The other leg is gonna stay flat on the floor, okay? You're gonna lift that leg toward the ceiling, and the closer you're able to get your hip to a 90-degree angle, the closer you are to normal flexibility, okay? So what you might find in yourself, if you're not very flexible, is that your leg is down here instead of pointed closer to being up at the ceiling. Okay? You don't really have to be at 90 to be completely normal. That is normal in a textbook, but not normal for the normal population that I see. But closer to that, the better. Okay? So that's one way to test it. Another way to test it would be to hold on to the back of your leg with your hip bent at a 90-degree angle, okay? And then straighten your knee, bringing your foot toward the ceiling. And again, you're looking at how straight can my knee get? If you have a lot of tightness in your hamstring, you're gonna find that as you try to straighten your knee, this is about all you got. You know, you can't get it to that full range of motion, okay? So in session 2 next week, we'll talk about some different ways to work on stretching your hamstring that will complement the foam rolling stuff you're doing to your hamstring. All right, next we're gonna look at flexibility in the front of your hip and thigh, okay? Again, you're gonna need your yoga strap or a dog leash or maybe a belt from your bathrobe or something like that, or the help of another person, okay? So you're gonna loop this around your foot and you're gonna roll over onto your stomach. All right, once you're on your stomach, you're gonna get yourself with your pelvis completely flat. So you don't wanna be kind of cocked off to the side at all, okay? One telltale sign of tightness in the front of your hips before you even start the test would be the inability to get yourself completely flat. If one hip is tight, you're gonna feel like one side is kind of poked up like this, okay? If both hips are tight, you're gonna find that your whole buttocks is poked up a little bit, okay? So what we're gonna do here is test the flexibility of the muscles in the front of your hip and thigh. You're again gonna leave your test leg as relaxed as you can, and you're gonna pull the belt or have your partner help you, bend your knee, and you're aiming your heel kind of straight up towards your buttocks, okay? It should be within just a few inches of your buttocks. If you only get, you know, here to a 90-degree angle or just a little past that, and you feel quite a bit of pulling in the front of your thigh, it means your quadricep muscles are tight, which are the muscles in the front of your thigh. The other thing that can happen if you're tighter up closer to the front of your hip is as you pull, I'm gonna make sure the camera zoomed right in at the side of my hip, kind of in this area. As you pull and bend your knee, what you may see or find or feel if the front of your hip is tight is that your butt wants to kind of poke up like that because it wants to take the pressure off of that muscle, okay? So when it's normal, your pelvis stays down flat as you pull. And when it's tight, it's gonna kind of poke up like this as you pull, okay? And you're gonna wanna test both sides because you can be tighter on one side than the other, all right? Next thing regarding flexibility we're gonna look at is some of the hip rotators. So one of the main ones is called the piriformis, but there are several other muscles that are a part of the hip rotator group. So if we peeled the big buttock muscle off and looked at some of the smaller muscles underneath there, that's what we're talking about here. So testing that, you're gonna lie on your back, both knees bent, and the leg you're testing, you're gonna cross it over and put your ankle up on the other knee, okay? One indicator of the rotators being stiff or tight would be that your knee can't kind of open up like this, okay? Instead, your knee is kind of stuck up this way, okay? If your knee can open up, the next step in testing it would be, can you bring your other leg toward your chest? And what do you feel? Some people will feel quite a bit of stretching here in the buttock area. Some people won't, okay? Some people will feel some pinching in the front of their hip, and that brings us back to tightness in the front of the hip. It could also be related to some stiffness in the joint, which I can't address so well here with exercises. That would be more of a physical therapy kind of thing, okay? So assessing how far you can get that knee open. Let me show on the other side in case that helps. How far that knee opens when you just set it up there, okay? And then bringing your thigh toward your chest and thinking about what you feel. Do you feel stretching at the back part of the hip and glute area? Do you feel pinching at the front of your hip? Or do you not feel a whole lot of anything? Okay. So those are things that address the flexibility in and around the hip. Some of the other things I do with patients is some strength testing. That's a little more difficult for me to have you do to yourself, but I'm going to talk about some movements you might notice being difficult if there's weakness in the muscles on the side of your hip. So the first one is testing the gluteus medius. This is a muscle that's a little bit smaller. You could look it up online. Gluteus medius. It sits kind of up here at the kind of top corner of your buttock instead of the bigger gluteus maximus muscle, okay? So in testing that, you could lay on your side and think about this bony point on the front of your pelvis, okay? Pretend that bony point on your pelvis has a headlight on it, all right? Right now, my headlight is sort of shining at the top of my kitchen counter, okay? In order to do this test with yourself, you're gonna make sure your headlight is shining toward the floor. So I'm really gonna roll my pelvis forward quite a bit. And now my headlight is shining right here at the floor, okay? And you're gonna put your leg behind you a little bit. Imagine like you're gonna rub your heel up and down the wall behind you, okay? From here, you're gonna work on lifting that leg toward the ceiling and think about leading with your heel. And you're gonna try to discover for yourself how difficult is it for you to maintain the proper setup and position during this movement pattern. Because if you're weak in the gluteus medius, what we're gonna see is that your pelvis wants to roll backwards and or your leg wants to come forward. So if I'm weak in this movement, this is more what it's gonna look like. You're gonna see my pelvis kind of rolling back and my leg coming in front of me, okay? If I have enough strength in this movement, I can keep my headlight shining on the floor and I can keep my leg behind me as I lift it up and down. Now again, the test would be a little bit different in a PT session because I would be able to put my hands on and help you figure out how weak things are. But the best we can test it here is through this movement pattern and also observing what it looked like when you did the squat and the lunge and the step down and things like that. The last one is taking a look at the strength of the hip rotators. So I'm going to try to show this from a couple different angles. The first one, I'll stay like this, and you're still going to think about this bony point on the front of your pelvis, rolling it forward so it's aiming at the floor. Don't be kind of reclined backwards where it's aiming at the ceiling, okay? So keeping the pelvis forward, bringing your knees up a little closer to your belly, so you're maybe about 70 to 90 degrees of hip bend, okay? You're gonna keep your feet stacked on top of each other, and then you're gonna open up your top knee in a movement called clamshell, okay? So when you do that, if things are working correctly, you should be feeling it here, kind of in the back pocket of your hip, okay? What you may find if you're weak in this muscle is number one, you can't open your knees very far apart without cheating or compensating, which would be rolling your pelvis backwards or using your body to produce the movement, okay? So I'll try to pivot here a little bit and just show it from another angle. Pelvis forward, feet stacked, hips at about 70-ish degrees of bend. Keep your feet together, keep your pelvis forward, and open that knee as far as you can, okay? So you're looking for the quality of the movement and kind of where you feel it working. If it's working right, you're gonna feel it at the top corner of your hip, kind of at the back pocket of where your blue jeans pocket would be, okay? So in the second session, we'll talk about how to address some of these things you may discover about yourself. What to do if your movement patterns with squatting or lunging or getting up and down from the chair or stepping down from a step look like the wrong movement patterns that we just talked about. what to do if you have tightness in your hamstrings or the front of your thigh, your quads and your hip flexors, and what to do about strengthening those muscles in your hips. Because all of these things will complement all of the stuff you're learning in boot camp and make your movement patterns that much more efficient, help you decrease or turn off pain complaints that you have, or help you make sure that you're preventing the onset of pain complaints as you continue to increase your fitness levels. So I'm going to have Sarah open it up to the group in case there's any questions here in these last couple of minutes. And if there's not, then I'll see you next week and we'll talk about how to address all these things.